Can a transient ischemic attack lead to a stroke? Have you ever wondered if a transient ischemic attack, often called a mini-stroke, can lead to something more serious like a stroke? The answer is yes. A transient ischemic attack can indeed lead to a stroke. A transient ischemic attack is a temporary episode of neurological dysfunction caused by a brief interruption of blood flow to the brain. While it does not cause permanent brain damage, it serves as a critical warning sign that a full stroke may happen in the near future. Both transient ischemic attacks and strokes share similar underlying causes. Typically, these conditions arise from blockages or narrowing of the blood vessels that supply the brain. The key difference is that, during a transient ischemic attack, the blockage is temporary and resolves quickly, usually within minutes to hours. This means that no lasting damage occurs. However, having a transient ischemic attack indicates a higher risk of experiencing an ischemic stroke later on, which is caused by a prolonged blockage leading to permanent brain injury. From a medical standpoint, a transient ischemic attack is a strong predictor of stroke risk. Research indicates that the risk of stroke is particularly high in the days and weeks following a transient ischemic attack. This makes it a critical time for medical intervention. Immediate evaluation and management after a transient ischemic attack are essential to reduce the risk of a future stroke. It is important to understand that both transient ischemic attacks and ischemic strokes often result from similar conditions, such as atherosclerosis, which is the narrowing of arteries, or embolism, which involves blood clots. Patients who experience a transient ischemic attack are usually assessed for the severity of their vascular disease. This includes evaluating the degree of artery narrowing to guide treatment and prevention strategies. Preventive measures after a transient ischemic attack focus on controlling risk factors. These include managing high blood pressure, high cholesterol, diabetes, and making lifestyle changes. Doctors may prescribe medications that help prevent clot formation, such as antiplatelet or anticoagulant medications. Because a transient ischemic attack is a warning sign, it is crucial to seek rapid assessment and treatment. Doing so can significantly lower the likelihood of progression to a stroke. In summary, a transient ischemic attack is a serious medical event that signals an increased risk for a subsequent stroke. Prompt diagnosis and appropriate preventive care are vital to minimize this risk and improve long-term outcomes for those who have experienced a transient ischemic attack. Always consult with healthcare professionals for personalized advice and treatment options.